Melanoma is the most dangerous skin cancer because it has the ability to spread to different parts of the body. This is called metastasis. Melanoma is not the most common skin cancer, but it is the leading cause of skin cancer deaths. Also, melanoma is more common in younger adults compared to other cancers, and if it is detected early, it has a high cure rate, while late diagnosis has a poor prognosis. That is why we will talk about how to detect melanoma early, how to treat it and prevent it when possible.
Melanoma is a malignant tumor which originates from melanocytes. These are the cells that produce dark skin pigment. The major risk factor for melanoma is UV radiation exposure to the skin. Melanoma is much better to treat before metastases occur. After metastases, the survival rate drops drastically. Approximately 1 in 50 white people will develop melanoma in their lifetime. The most common age of diagnosis of melanoma is after 55. Although it can occur at any age, the most common scenario of melanoma is when a new dark and irregularly shaped mole appears on sun-exposed skin such as the back, legs, arms and face. They look like irregularly shaped moles, so asymmetry is the main characteristic. Border irregularity, uneven, notched or blurred borders. Another important characteristic is color variation, multiple colors and uneven distribution of color within the mole. They are larger in diameter, usually more than 6 millimeters, and they change shape and size over time. Based on these characteristics, we have the ABCDE Rule, which helps to identify melanoma. A. Geoasymmetry, which means one side of the mole does not match the other half. B. Borders, which are irregular. C stands for color, meaning the color of the mole is uneven. D means diameter, as the mole is larger than 6 millimeters. And it means evolving, meaning the mole is changing size, shape, and color over time.
We should be attentive when a new mole appears, which changes in size, shape, or color, or an existing one. When a mole is bleeding or itching or failure to heal, the sore that does not heal, or satellite moles appear, which are new small moles that appear around the larger mole. Also, we should be careful about the ugly duckling mole. This refers to a mole that looks different from other moles on a person's skin. When melanoma spreads, first it affects lymph nodes. Swollen lymph nodes near the primary melanoma site are common. These may feel like firm, painless lumps under the skin. After this, the cancer can spread to lungs, bones, brain, and liver. Sometimes melanoma has no classical dark mole-like appearance.
In this case, correct identification is crucial. For example, in the case of amelanotic melanoma, it has no dark color but can be skin color or red. Asymmetry and shape irregularity are still important in this case, and we can add the 3R principle, which means red, raised, recent, change, help in identifying amelanotic melanoma. Another type of melanoma is nail melanoma, also called subungual melanoma. It presents as a dark streak within the nail. If you notice a pigmented band or streak in the nail, that is not explained by trauma or nail disease. Pigment extending onto the skin around the nail, nail fold, and or surrounding skin is a significant warning sign of advanced nail melanoma. It is called Hutchinson's sign. Another type of melanoma is ocular melanoma. More commonly, it occurs in people with light eye color, blue or green, fair skin, and age, and causes dark pigmentation on the iris, which is the colored part of the eye. Patients might experience vision changes, the appearance of floaters, or even eye pain. And mucosal melanoma. It occurs in mucous membranes, such as in the nasal passages, mouth, anus, or vagina. These melanomas are rare and are often diagnosed at later stages. Due to their hidden locations, symptoms might include unexplained bleeding, masses, or pain in the affected area. Thus, unlike cutaneous melanoma, mucosal melanoma is not linked to UV light exposure. Risk factors are less defined but may include smoking, ill-fitting dentures, HIV, foreign rectal, and genetic predisposition. For diagnosis of any melanoma, any suspicious lesion should be biopsied for definitive diagnosis. Cumulative and intense exposure to ultraviolet radiation from sunlight or tanning beds is the most significant cause. Genetic mutation is also important, for example, in the BRAF gene, disrupt normal cell growth control, leading to malignancy. Risk factors for melanoma are excessive sun exposure, especially during childhood. Fair-skinned individuals with lighter skin, red or blonde hair, and blue eyes. History of sunburns, particularly blistering sunburns in early life.
Family history. A history of melanoma in the family increases risk, and multiple moles, especially atypical or dysplastic nevi. Patients often report a history of prolonged sun exposure or intermittent intense exposure. For example, beach vacations, outdoor work. So there is a strong correlation with sun exposure. Melanoma may look like different conditions. For example, benign moles, nevi, typically stable in size and appearance. Dysplastic nevi are atypical moles, resembles melanoma, but lack of malignant features on biopsy. Basal cell carcinoma presents as pearly nodules with telangiectasia, and squamous cell carcinoma, a scaly ulcerated lesion. For prognosis, metastasis has huge importance. If metastasis occur, 5-year survival drops to 25% from 95. Also, tumor thickness is important. Ulceration also worsens the prognosis. For treatment, surgical excision with appropriate margins is the mainstay for early stage melanoma. Immunotherapy, checkpoint inhibitors like pembrolizumab, nivolumab have significantly improved outcomes. And targeted therapy agents such as BRAF inhibitors for patients with specific genetic mutations. Early stage melanoma is typically cured with surgery, whereas advanced melanoma may require long-term systemic therapy. To avoid melanomas, the key measure is to protect from the sun.
Broad-spectrum sunscreens with an SPF of 30 or higher. Wear protective clothing, hats, and sunglasses. Seek shade during peak sunlight hours. Annual skin checks by a dermatologist are recommended for high-risk individuals. Before the age of 50, women are more likely to develop melanoma. After the age of 50, men are more likely to develop melanoma, and men are also more likely to be diagnosed with more aggressive forms of melanoma and have poor outcomes.